Thank you, Doctors Kanda, Halfdanderson, Malik, and Sukrathon for your informative presentations, underscoring that neuroendocrine cancer is in fact a cancer, that it is heterogeneous, and it requires looking at the whole person, not just one marker, number, or scan. It truly requires a whole person approach and multidisciplinary care. This next section is on understanding my options, surgery and local regional therapies. Dr. Hendifar, when in one's journey is surgery or local regional therapies an option? And I think patients often wonder if they should see a medical oncologist or a surgeon first, or if they should see both.
Yeah, this is a super important question. At every point in the patient's journey, there could be times for a surgeon to be involved or for local regional therapy to be an option. But I think the best time to get everyone on the same page is at the beginning. And I know it's hard, but it's best to see both the surgeon and the medical oncologist right from the start. And then they'll direct you to talk with you to figure out which camp do you probably fit best into. And then every once in a while, you should check in with all the providers. We do that very often in our multidisciplinary conferences where we discuss a case and everyone's back at the table talking about it. Most places don't have that luxury. So if you're in another type of place, you can recreate that experience by occasionally meeting with your physicians and your provider team.
Thank you for describing that. So definitely in the beginning and perhaps different points along the way. Mary, you faced surgery and local regional therapies. How did those decision points feel for you?
Ooh, I can say those decision points weigh very heavily each time. As someone that has had 4 abdominal surgeries, including a Whipple and 2 liver resections, I can attest that every decision has involved a great deal of thoughtful discussion with my team, especially Dr. Hendifar, and also the surgeons as well, and the IR doctors. I pursued some fairly invasive treatment because of my age and my health in the past. And at the same time, I knew that local regional therapies may not be ideal for myself due to my surgical history and because of my concerns for infection. So this is where my team and I have to weigh in what's optimal for me and specifically for me. And I really learned to appreciate how individualized the net care has to be for each person individually.
Each person is unique. Dr. Hendifar, what do you hope the audience takes away from this topic that will help them in making decisions?
I think it's just super important that in a disease where there's different providers can help in different ways, I hope the audience will try to do their best to engage the entire team as much as they can. And sometimes that means maybe meeting with the provider that's not making that many medical decisions at that particular point. I think that's really important. It's also reassuring and it gives different perspectives, different ways of solving the same problem. Because I'll be honest, sometimes I'm thinking about something a certain way and I'm doing it as the same way over and over again. And, patients deserve kind of a fresh perspective on the situation as it stands. Also, Mary made an excellent point, especially after Whipple surgery. Liver-directed therapy is actually potentially problematic or dangerous. So that's another great key learning point from today you should take.
Yeah. So really engaging a whole team perspective and really trusting that team approach. Thank you. Mary, what is one piece of advice you'd like to share with those who may be weighing surgery or local regional therapies as options?
Well, I'm glad I did exactly what Dr. Hendifar told me to do because about 2 years ago, I was having to make the decision between surgery and embolization. And I consulted with him first. And then I spoke to my surgeon. And then I spoke to actually 2 IR, interventional radiology doctors about weighing what my next best option would be. And although I have chosen surgery 4 times, I still have considered all treatment options in systemic treatments, local, regional, at every crossroads. So I guess my advice would be to consult, like we've talked about, Lisa just mentioned, and Dr. Hendifar, with all specialties so you are very well educated and know your options and feel comfortable going with your decision.
Getting all the different perspectives help us make informed decisions. And in that note, we're pleased to introduce our next set of speakers who will focus on surgery and local regional therapies for neuroendocrine cancers.
Dr. Julie Halle is a surgical oncologist at Sunnybrook Health Sciences Center, and she will share her valuable insights and the goals of liver surgery and how these are very unique to NET. and also why and when liver surgery is best for those that are living with NETs.
We're very pleased to have Dr. Alejandro Gabuti, who is an interventional radiologist from the National Institute of Medical Sciences and Nutrition in Mexico City. The title of his talk is What Matters About Liver-Directed Therapy. We have a great panel for you, moderated by Dr. Dan Lee, and with panelists Dr. Calicia Clark, Dr. Ahmed Ahmed, and Dr. Will Chen. They'll be talking about what matters most in making decisions about surgery and local regional therapies.
As a newly diagnosed patient, Rashilda shares her journey of how she found her NET medical team and emphasizes the importance of feeling confident and comfortable with them. She will also open up about how NET has impacted her mental health, and she'll share some steps she took to address and manage her concerns.